Good afternoon, everyone. Thanks for the opportunity to present. I'm Jonathan Leipsic. I'm Vice Chairman of Radiology at the University of British Columbia, and I hold a Canada Research Chair in Advanced Cardiac Imaging. I'm going to be talking to you for the next 15 or 20 minutes or so about the impact of nitroglycerin on acquisition of coronary CT angiography, its importance in both clinical care as well as for eventually the derivation of fractional flow reserve from a resting coronary CT. When we look at nitrate application, it's been well established in the guidelines dating back to 2009 with Dr. Ibarra's first iteration of the SCCT guidelines, and now with the restatement of the SCCT guidelines, which are now online in the Journal of Cardiovascular CT, that nitroglycerin administration for the acquisition of coronary CT is essential. It's essential for a number of reasons. One is its effect on the vasculature, both the vessel diameter as well as the delineation of branches. It's also important because it has actually been shown to improve diagnostic accuracy. And I think if we want to look towards these net effects, we need to understand why it has this effect, how to best administer it, and really dive deeply into best practice. It's one thing to say you give nitroglycerin for your coronary CT angiograms. It's another thing entirely to adhere to best practice and ensure that you're optimizing that practice. So I just thought I would start with an example of the visual impact that nitroglycerin has when evaluating coronary CT angiography. We know that nitrates have a direct effect on the vasculature. They're direct vasodilators, and they do so by inducing smooth muscle relaxation, causing dilatation of the coronary arteries. We can see the exact same patient here. This lent to us from Japan, from Yamaguchi Medical Center. On the image on the left, without nitroglycerin, the image on the right, 5 minutes after the administration of sublingual nitro. Any of my fellows can look at this image and it's very clear which image they'd rather interpret. The image on the right is much more not only pleasing to the eye, but would be much easier to interpret. The coronaries are larger, the branch vessels are clearly delineated, they're more branch vessels. It's inevitably a better image and more accurate. These data that I showed you, or this anecdote I showed you, is well established both in the mechanism of nitrate administration or nitrate-mediated vasodilation, but also going back historically into the angiographic literature. Here are examples from the historical literature dating back to 1979 from Dr. Feldman's paper in the American Journal of Cardiology. We can see the vasodilatory effects in a similar fashion, in this case on invasive angiography. What we see here is both intracoronary and sublingual nitrate administration results in significant enlargement in the coronary arteries. When we look at the literature, again, this is not new data. People are saying, well, you know, I can read coronary CT without nitroglycerin. Well, the reality is the reason it's embedded in the guidelines is because the data is rich and mature and goes back over 35 years. Here we can see both intracoronary nitroglycerin, again from Dr. Feldman, and sublingual nitroglycerin at 0.4 milligrams. We can see that when we actually look at the size of the vessels, the vessel segmentation, the size of the vessels, there's significant vasodilatation following the administration in both the proximal and mid-coronary segments. And it's similar whether it's sublingual or intracoronary. So if we're looking at coronary CT angiography for diagnostic purposes, clearly nitroglycerin is of value. When we're looking at FFRCT, it's perhaps even more important because intracoronary nitroglycerin is given at the time of FFR measurement. And if we're seeking FFRCT, then we should mimic the conditions in which measured FFR is performed, which is with nitroglycerin on board. So it makes sense to, even if you're a naysayer about its role for stenosis detection, of which I'll show you more data that would suggest that you shouldn't be, but if you're looking to do FFRCT, then it behooves us to administer sublingual nitro to mimic the conditions in which measured FFR is undertaken. As we move forward, people say, well, you know, what's the data supporting it in coronary CT? I don't do FFRCT in all cases. Do I really want to change my practice? Well, there's robust data. It doesn't go back to 1981, but it goes back to the early days of 64-slice CT. This comes from Mark Dewey from the Charité in Berlin, and he looked at vessel diameter on CT in patients with and without administration of nitrates. And what we can see is very similar vasodilation that we've seen in the literature from Dr. Feldman and others dating back to the late 70s and early 80s is now noted by Dr. Dewey and his colleagues with approximately 14% luminal area increase following the administration of nitroglycerin as compared to prior to nitroglycerin administration. When it comes to side branches and perforators, this is now by Dr. De Kramer, published in the American Journal of Röntgenology in 2008. When we look at the actual increase in size, in this case we can see an increase in number of septal perforators, increase in size of the vessels in 42 patients that were evaluated with and without nitroglycerin. This is not new data. This is well established in the coronary CT data, almost 10 years old, showing improved delineation of side branches, larger vessels, making it easier to evaluate stenosis. When it comes to the actual diagnostic performance, we've also seen data now, this coming from Korea. Following the utilization of nitroglycerin, all measures of diagnostic performance are improved. So even if you're not looking at FFRCT, if you're trying to optimize your clinical practice, improve your diagnostic performance, especially I think amongst less experienced readers, nitroglycerin is your friend. Nitroglycerin helps improve your diagnostic performance.